Yes. Good morning.
Yeah, very good morning, Doctor. How are you?
Okay, thank you. Fine, thank you.
So, thank you for your valuable time during this fine morning.
No problem. You are there. You are my friend. So whenever you ask, I can say.
Thank you so much.
Okay, comfortable. Okay, no problem. Now,
Yes.
okay. All right.
Yeah, Munir.
Sir.
Yeah, you please start now.
Okay. Sir, a very good morning to all the faculty members, sir.
Hello.
Sir, is it audible, sir?
Yes, audible now.
Okay.
Sir, a very good morning, sir. We welcome you to the third day of our FDP program on best practices in teaching and research. Now I request our principal sir to give a small address to address our today's gathering and welcome our today's speaker, sir, Dr. B. Somsekhar garu. Sir, please, more to you.
Yeah. Thank you, Dr. Munir. So, first of all, thanks to Dr. Somsekhar for his valuable time and for acceptance for this eFDP of our institution.
Thank you.
First of all, on behalf of my management, my students and staff, I welcome you for this eFDP program of this best practice in teaching and research. The Somsekhar is my best friend, and so today is going to be deliver the lecture on the drug interactions. Might be very useful for our students and as well as the faculty members. So hope this section will be placed with our faculty members. Thank you. Over to Munir.
Sir, thank you very much, sir. And now I request Dr. K. Ravi Kumar sir to give a welcome note on our today's speaker, Dr. B. Somsekhar garu. Sir, please, over to you, sir.
Good morning to all the participants, sir. Today's participants. It is very pleasure to introduce the today's speaker, eminent speaker, Dr. G. Somsekhar sir. So, Dr. G. Somsekhar sir had earned degree B Pharmacy as well as M Pharmacy from University College of Pharmaceutical Sciences, Andhra University. Sir had received a doctorate in Pharmaceutical Sciences from JNT University, Hyderabad. Sir had solid academic credentials of more than 26 years of teaching experience in India and abroad. Sir had 16 years of research experience in medicinal chemistry of natural products, heterocyclic compounds. Sir had contributed for establishment of laboratories at SN Vanita Pharmacy, Mahila Vidyalaya, Hyderabad. And Sir also acted as head for the Faculty of Pharmacy, Homer, Al Mukhtar University, Libya, from the country Libya. Sir had guided several undergraduates as well as the postgraduate students. Sir has served as serving as an evaluator for PhD thesis at Acharya Nagarjuna University, Krishna University, as well as Geetam University. Sir presently serving as a BOS member at Sri Krishna University in Department of Pharmaceutical Sciences. Sir had an extraordinary efforts in research, which leads to the publications of more than 25 original research papers in national and international journals. Sir had attended various national and international conferences and also acted as a resource person for several conferences. And currently, Sir is working as a principal at SKU University of SKU College of Pharmaceutical Sciences, Sri Krishna University, Anantapur. So with this short introduction, I will invite our today's eminent speaker Somsekhar sir to give his excellent delivery. Thank you, sir. Thank you for giving an opportunity.
Thank you, sir. Thank you for introduction me. And it is okay. And a very good morning to one and all. Is it audible?
Yes, sir. Yes, sir. Audible, sir.
So very good morning to one and all. Respected principal of Santhiram College of Pharmacy and convener of today's eFDP program, Dr. Madhusudan Shetty garu, and respected organizing committee members of today's eFDF program, and principals of different colleges in and around India, and delegates from different parts of India who are attending this program, and my dear young dynamic budding farms. Once again, a very good morning to one and all. And today, as we know, the drug interaction, my topic is drug-drug interaction and drug and food interaction, how the actual drugs are going to interact and how to prevent it. As being a pharmacist, we have expertise in the drugs, so that, and I have chosen this drug-drug interaction. Now, as we have gone through a long, pathetic and pandemic situation during 2020 till date, and during that time, there was no treatment option for corona. Even our actually healthcare professionals struggled a lot and did a lot of hard work to find a medication because there is no targeted drugs. And some of the drugs which are used not yet even completed clinical trials. So the drug-drug interaction plays a major role in the establishing the safety of drugs. At this point of view, I would like to present a topic known as drug-drug interaction to bring awareness on uses of different aspects of drugs and drug-drug interaction with the suitable examples. My topic actually, the content, because of drugs, so many drugs I'm giving as an examples instead of giving and how they interact with the body and how to prevent it and to minimize the side effects. Now coming to what is a drug first? Drug is a chemical substance and which is obtained from either plant, animal or mineral source, and which is used for either treatment or prevention, cure of diseases, and as a diagnostic agent. As we all know that the drugs are available in the market not only produce the useful therapeutic effect and also induces adverse effects also. So when a situation arises to receive a multiple drugs by the patient, there is a possibility of drug-drug interaction. Now coming to the what is a drug-drug interaction? What is it? Drug interaction refers to a phenomenon which occurs when the effect of one drug or modified by the prior or concurrent administration of another drug. Coming to what are the reasons why you have to study the drug-drug interaction? Because drug-drug interaction actually, when a multiple drugs are inserted, there is a consumed by the patient, there is a possibility. Apart from adverse effect, there will be critical situation also. And the report says that, and actually here, getting of 36 drugs at one admission in a well-known country, it is a developed country, by the patient who are admitted in the USA hospital, one of the King George hospital. So you can imagine when the multiple drugs are entered to the body, there is a possible interaction. So how to overcome, that is actually today's my topic. The drug-drug interact, drug-drug, they will react, and drug and beverages, alcohol and other food products, dairy products, that may lead to some, if they influence the drug activity, it may be alter the drug effect, especially, it may be, generally, most of them are harmful, the drug interactions. So very few are beneficial. So reasons why actually the drug interactions will going to occur. The possibility of occurrence of drug interactions are, there is one, use of non-prescribed drug. You know that already many people actually use plenty of drugs. So the drug-drug interaction involved concurrent use of a prescribed drug by the physician. Apart from that, non-prescribed drugs which are not without prescription because given by the doctor or physician. So non-prescribed drugs generally available in the market with as of OTC products, aspirin, antacid, nasal decongestant, and as well as anti-allergic, certain anti-allergic drugs. When a physician question a patient about the medication, that he or she does not actually disclose about non-prescribed drugs that actually is obtained from outside. So there is a possibility of interaction, maybe also actually the result from concurrent use of 2 or more drugs available in the market without prescription. Even sometimes, because it is a quite unfortunate, drugs are available not only in the retail shop, wholesale shop, it is also available in even pawn shops also. Pawn vendors also in villages, they're actually supplying without any prescription. Who doesn't know about the medicine, so that the non-prescribed drugs are more dangerous by using more two or more drugs. That leads to sometimes entire drug interaction takes place. Now, coming to the useful multiple prescriber. So, some of the individual to see more than one doctor and it is also not uncommon for a patient to be seeing one or more specialists in addition to family doctor. So you can imagine, apart from the family doctor and there is a physician and as well as one specialist, so that they prescribe a different drugs according to their diagnosis. And when actually the multiple drugs are prescribed by the doctor, different doctors, if it's consumed by the patient, there is a likely to occur a drug interaction. Apart from this, some individuals also are seeing, other than professional, is known as dentist, even pediatrician, and children specialist. It may also lead to the drug interaction because they also provide some medication. So when multiple prescriptions are taken and drugs are taken actually without any advice, then there is a reason actually known to occur drug interaction. Now, for example, a physician prescribing a drug known as antihistaminic for a patient for whom another physician is prescribed an anti-anxiety agent. When both are administered, which in turn leads to an increase of CNS depressant activity, instead of having useful effect, there is a depressant activity. Now coming to geriatric population, it is a common problem, quite common problem in old age people. Generally, they'll be using more number of drugs at a stretch, 5 to 6 at a stretch in a day, and at several times, not 4 or 5 times. And they also take the instruction from the physician as well as pharmacist, but they have a nature of actually forgetting, confusion. Because of that, they may be using multiple drugs at a stretch instead of actually by forgetting. So there is a possibility of other drug interaction. And apart from that, there is a drug abuse and misuse of drugs. This is the more actually, it is a tendency of some individuals to abuse the drugs, use of abused drugs, and deliberately misuse of drugs that in turn lead to an increased drug interaction. Particularly, drug abuse include, it is a CNS depressant, barbiturates and benzodiazepines, as well as amphetamine, narcotic analgesics, actually without any prescription, if they take actually an inappropriate concentration, use of these drugs leads to a drastic and a lot of consequences occurs in the body. So that it is a person, actually healthcare professionals should advise them. If they come and advise to the way patient come and can come and move to the prescribed drug, then he or she can advise as a healthcare professional. But without knowing that's a prescription, it is a difficult. So this is the drawback to known to occur what we can call it as drug interaction. So one should be vigilant about drug interaction when use of multiple drugs at a stage. And also drug and herbal formulation. Similarly, drug and food products such as grapefruits and milk and other dairy products like cheese, butter, which also have got an influence in the drug activity, and the failure of sometimes drug interaction leads to the failure in the food. So it should be avoided. So it is only the responsibility of the healthcare professionals to advise while administration. It is common procedure in developed countries like USA and other. They advise every drug information is kept in the system. They used to advise while actually dispensing the medicine, but unlike India. Now, the environmental factors also play an important role and they have influence in the drug activity. Apart from that, drug pollutant. In the environmental pollution leads to, there is a exposure of what? Carbon monoxide and hydrocarbon, which in turn leads to drug interaction. And other drug interaction like certain drugs also produce undesirable effect, as are told in the patient who are already existing pre-established certain disease like kidney problem as well as, and it is a liver problem. So that it has to be taken care actually the pre-history of the patient while deciding the dose of the drug. Now, where it happens, how the drug reaction interaction will occur. The drug interaction likely to occur the outside the body, right from the being manufactured, the stage of manufacture, formulation stage, till its elimination of the body, there is a possibility. And also during absorption and as well as during distribution, during metabolism and excretion. Apart from that, there is a pharmacodynamic interaction and drug interaction with the vitamins and other condition. Now coming to let us discuss about drug interaction outside. It is a common procedure you might have observed all of us. It is a quite common especially in the hospitals, like primary health center and corporate hospital, where the drug need to administer to the patient along with the infusion fluid. Instead of giving the separately, there is adding directly a nurse and health professional like nurse will be adding directly to the infusion fluid, and that leads to there is a incompatibility of the drug and thereby loss of potency occurs, and it in turn leads to an untoward effects. So similarly, the addition of more than one drug, if it is needed, instead of giving to the patient separately, they actually inject direct infusion fluid, and that may result in interaction and ultimately leads to loss of drug activity. For example, diazepam. Diazepam actually a well-known example, and people actually it belongs to benzodiazepine derivative, which is used for the multi-purpose as a central. Actually, it is a sedative. It reduces the emotion and tension, anxiety agent, as called as minor tranquilizer. And apart from that, actually pre-anesthetic medication to reduce the tension, and also central muscle relaxant, and as well as it's certain seizures likely to occur repeatedly in the kids. That is called as status epilepticus. Can also be treated by making use of diazepam. It is a prototype of actually benzodiazepine derivative. When this benzodiazepine derivative diazepam is added to the infusion fluid, which in turn leads to precipitation and loss of activity instead of producing useful effect. So that there is another part. Now the mixture, it is not only benzodiazepine and other only infusion fluid, there are other drugs. So here phenytoin, we added. Phenytoin is the drug of choice, particularly for the treatment of major epileptic disorder like grand mal epilepsy by inhibiting sodium channels. This phenytoin, when added to the infusion fluid, can actually then what will happen? There is a precipitation takes place and inactivation of the drug activity. So the purpose won't be served. So that's why the remedy is administered. There is a infusion fluid.
This is
added the phenytoin.
This is a temporary seat. Visiting seat. Visiting
unable to absorb generate dextrose and lactate and saline lactate. So never be given phenytoin along with the separate administration of the drug. Now coming to the heparin, which is a well-known example for anticoagulant. The heparin is a anticoagulant given by injection. Nowadays even of the corona. To produce a clotting, that induce a clotting that even deaths also are known to happen. So heparin was used. When heparin, apart from that, even the steroids also were used for the treatment of mainly allergic disorders and even lung infections, especially apart from that, it is an asthmatic condition and as well as arthritic condition, hydrocortisone. Is a drug of choice. These two. When both of them are actually combined, the inactivation of heparin and loss of anticoagulant, the purpose of is a possibility of coagulation, and even after administration of that, people will be thinking that heparin is there in the body. When you combine it, the loss of heparin not available because of inactivation. So to get the activity each one of them in the mixture, it is better to add give the drugs between the two drugs so that the activity of each drug can be obtained by the patient. Similarly, kanamycin. All mycins, most of them streptomycin, kanamycin, and gentamicin belongs to aminoglycoside antibiotic, mainly used as an antibacterial agent. It is also a case when you given as an antibacterial agent. Apart from that, it is combined with hydrocortisone as a mineral corticoid. There is a possibility of inactivation inactivation. So at least 1 hour gap should be maintained within drugs, even carbapenicillin and gentamicin. Also there is a possibility though, and people will think that carbapenicillin is a beta-lactam antibiotic, gentamicin, aminoglycin, both of them antibiotics, so that it may have additive effect, but instead of that, when you mix it, the inactivation of one drug takes place, so that, and so the purpose won't be served. So better to avoid and administer. If you need to administer, the gap should be maintained in the two drugs to prevent it, to prevent the drug-drug interaction. Now coming to the absorption. As we know that, to actually any drug, to produce its activity, it has to absorb. So for the absorption, drug need to have, actually it should exist ionized form and lipid soluble. So that when it is ionized or lipid soluble, it crosses the membrane and enters the circulation. So what is the actual absorption? It's the process of getting drug molecules from the site of application to the circulation. Once it is entered into circulation, then it is a mode, there is a distribution. It is a movement of drug from the, actually after absorption through blood to the site of action. When it reaches the site of action, it exerts its activity binding the chemicals, and accordingly it exerts drug receptor complex, sometimes drug ionic enzyme complex, and the receptor complex will produce the drug activity. And in fact, after having activity at the site of action, after duration, once it is over duration, then it comes, actually it is metabolized by means of enzymes which are located in the liver and other kidneys, other intestine, brain, where it is most of the metabolic enzymes predominantly located on the liver, mixed oxidase function, oxidase as well as hydrolase, there is esterase. So many enzymes are known, which is the ultimate metabolism role is to terminate the drug activity and convert it to water soluble form, from where it is filtered through kidney. And it is the elimination takes place once it is water soluble, it is easily filtered by kidneys by means of passive diffusion and active secretion through kidney tube, then it is eliminated. So as we know that most of drugs, it is the 95% of drugs available in the market, when administered, the change in form or eliminated in the urine, not as such. Very few drugs are change in form is eliminated. For example, drug-drug interaction in the stomach takes place right from the mouth to any part of the body because of there is a what we can call it as due to change in the microbial flora, change in the specificity and the GI movements. There is a plenty of actually example I quoted here. There is a absorption when the drug and form and complex absorption is given a blue combined along with the antioxidant taken. The pH is a high pH is created in the stomach. Then what will happen? And the stomach lack of acidity and the medication not be well absorbed. So there is another problem. So that, as I told you, to have a drug activity, drug must exist ionized form, the membrane and well absorbed. Coming to what are the and alteration of GI flora. The intestine, there is a useful microorganism will be there layer. That is a microbial flora that is required for the metabolism of certain drugs as well as the absorption and synthesis of certain drugs, vitamins and minerals, and as well as they may not be of certain drugs may not be absorbed, not metabolized, and leads to there is change in the drug activity in the small level because of. And another one is malabsorption syndrome. So coming to one by one, let's go side, which is a leafy drug mainly used congestive heart failure for the treatment of congestive. But cholestyramine, it is an anti-hyperlipidemic agent, lipid level lowering. How it produces? Cholestyramine is a sensitizer of bile. Bile juice is required for the absorption of mainly lipids. So the cholestyramine is intentionally given to actually sensitize or form a complex with the bile juice. Thereby, lack of bile, the fat, the people who are taking, that is the fat may not be absorbed. So that is the purpose of to reduce the cholesterol and lipid level. That is the purpose. When you combine the dialysis cardiac patient and you combine, then what will happen? Cholestyramine, it complex apart from the bile juice, it is also form a complex with the dialysis, and thereby by absorption mechanism, thereby the activity of dialysis will not be produced appropriately. So there is a need of increase of drug in such case, or otherwise avoid the administration of two drugs simultaneously. Similarly, warfarin, which is a well-known example as a anticoagulant and cholesterol. cholesterol as such, I told you. Similarly, it is a sensitizer. Absorption of bile juice is actually form a complex, and thereby the warfarin also it is a drug also along with a given form a complex and lack of the what are the activity as it oral anticoagulant activity. So it is a review so that no never will be given a combination towards and similarly, thiazides are diuretics. Chlorothiazide, hydrochlorothiazide, benzoyl, these are the thiazide derivatives mainly used for control blood pressure because they capable of reducing what are the fluid volume by increasing the output of urine and as a diuretic and also capable of relaxing vascular smooth muscle to a certain extent. So, and apart from that, volume is reduced and sodium also reduced and preventing reabsorption so that thiazides are the adjuvant for the treatment of even hypertension. And as a when you combine with cholestyramine, as I told you already, form a complex with bile, and similarly, if you given thiazides, also form a complex and make unavailable thiazide appropriate in the plasma level and decrease the thiazide's activity so that never be given with the cholestyramine along with any other drug. Cholestyramine and both should be, if needed, to administered should maintain the gap at least actually 2 to 3 hours so that the purpose of each drug will be served. Otherwise, there is a one drug activity of is failure of the two drugs activity. Now come to the antacid along with if administered oral contraceptives. OC in the sense it is an oral contraceptive. Oral contraceptives consists of hormones. Hormone is also called so antacid actually that is mainly to use purpose is actually absorption. They act by absorption mechanism, particularly acid is pepsin is by absorb the pepsin and the pepsin act decrease and acid's concentration decreases so that hyperacidity is reduced. That is the purpose of antacid. When you combine with particularly oral contraceptives, in particular antacid known to contain a mixture of components. What is magnesium also, sodium you know is a well-known example. It is sodium bicarbonate. Apart from that, magnesium silicate, trisilicate, magnesium hydroxide, and other compound, even magnesium oxide also there. So the combination is there. If you allow separate, even calcium carbonate is a separate. When you combine with the prevent the conception because contraceptive to avoid the pregnancy. And the unknowingly unprescribed drug antacid is taken prevent the absorption of absorption mechanism or complex formation. Oral contraceptive and oral contraceptive is taken, not available, not reaching the plasma level. So what actually we have to give advice? Antacid whenever taken should be avoided with any other drug at least 1 to 2 hours. So given a spacing of drug, then the purpose of each drug can be served. Otherwise, there is a drug interaction. Similarly, fluomanic acid, that is the anthralic acid derivatives, all of them. Mefenamic acid, mefenamic acid, they belongs to non-steroidal anti-inflammatory drugs. When you given non-steroidal anti-inflammatory drugs along with what actually we can call it as antacid, there is a possibility the absorption because by absorbing all the drugs and make unavailable this non-steroidal anti-inflammatory drugs by the contain inflammatory activities we reduce. So here there is a need to administer non-steroidal anti-inflammatories and along with the any antacid should be avoided or to get actually this activity. Coming to naproxen along with the antacid. The mechanism, what is the result? Generally alter the rate of absorption. Naproxen, apart from there is a analgesic, antipyretic, activity, it is having antiplatelet activity and long-lasting anti-platelet aggregation activity. So when you combine with sodium bicarbonate, it is absorption is increased because creating high pH. So that is why and thereby increase absorption. Whereas actually sodium bicarbonate solubility is increased, so the absorption rate is increasing. While other antacids like magnesium containing magnesium, trisilicate, magnesium oxide, magnesium hydroxide, as well as aluminum hydroxide, if you combine combined with normally decrease the absorption. So this is what is actually mechanism. Look at that mechanism, naproxen, nostril, soluble as pH rises, which may account for increased absorption when combined with sodium bicarbonate. Whereas the magnesium salts, they form insoluble complex with the naproxen, and the purpose of naproxen is will not be served. So how to manage? The management is antacids should contain magnesium and should be avoided, and while using naproxen for the treatment. Similarly, antacids and tetracycline. This is a well-known example, everybody, right from the actually even students maybe know even first year is B Farm only will be learning. So tetracyclines and antacids, they have actually capable
ఇంకా
of
సార్ అబ్జార్ప్షన్లోనే ఉన్నాడు.
because the divalent, particularly trivalent containing
నేను తొందరగా అయిపోతాను అనుకున్నా ఇంటరాక్షన్స్
these are actually
అబ్జార్ప్షన్లో ప్రతి ఒక్క డ్రగ్ చెప్తున్నాడు సార్.
there is a and decrease absorption and thereby species must be given between also decrease the as pH is rising, to neutralize excess acid present in the stomach. Decrease. So the purpose of tetracycline as antibacterial is decreased due to lack of bioavailability. So coming to the nitrofurantoin and antacid. Nitrofurantoin was the first, actually it is the old urinary anti-infective, and this is a furan derivative. It is actually used antibacterial agent to treat the urinary tract infection. It was the only drug of choice earlier. Now there is plenty of drugs. When you combine antacid with the same mechanism, there is absorption of nitrofuran by especially the magnesium salts, trisilicate magnesium hydroxide, and decrease the gastric intestinal absorption. Thereby, what will happen? The purpose of nitrofurantoin as a it is better in tetracycline. So if you need to have iron to supplement along with the antibacterial activity of tetracycline, avoid tetracycline. In case of tetracycline, other substitute will be given, like which does not form a complex with iron. The other antibiotic will be given, or otherwise we need to give a tetracycline along with iron, that actually